So there's this term that's taken over the internet, Looksmaxxing. Have you heard this?
Well, I hadn't heard it until we started talking about the episode, and honestly, when I did first hear it, I thought it was a joke. Then I looked into it and realized how many young guys are genuinely building their lives around this stuff.
Yeah, no, jaw trainers, mewing, right? Bone smashing, testosterone boosters. There's an entire online community dedicated to hacking your face.
And here's the thing. Some of it isn't actually crazy. Some of it's just basic health advice in a hoodie. But, but a lot of it's pseudoscience and some of it's genuinely harmful.
And we're not coming at this from the outside. We're both facial plastic surgeons. We see patients every week who've gone down these rabbit holes, young guys especially.
So we wanted to engage in the conversation that nobody's engaging with them. What actually works? What's a waste of money? And when does self-improvement quietly turn into something concerning?
I'm Dr. Ben Cilento.
I'm Dr. Lee Mandel.
This is Vital Discourse. Okay, let's define it, Lee. What is Looksmaxxing?
Well, the definition, at its simplest, is deliberately trying to improve your physical appearance. That's it. By that definition, your grandfather putting on a nice shirt was Looksmaxxing.
Right, exactly. And that's the trap, right? Because the term has come to mean everything at once. I mean, people call it hacks, biohacks, looks hacking, but it's all the same thing.
Yeah, biohacking, that's kind of what I really would always have termed it. It came out of online male self-improvement communities, and it spans a massive spectrum. On one end, get more sleep, fix your acne, hit the gym, totally reasonable. On the other end, let someone smash your face with a rock because a forum told you the bone heals back more chiseled.
And those are not the same category. I think that's pretty obvious. The internet packages them together, though, slaps the word self-improvement on the box and sells it as just one thing. It's nuts.
Yeah, that's the core problem of this whole episode, really. The reasonable stuff and the unhinged stuff are wearing the same uniform.
And most young guys are getting this advice from influencers, not from anyone who's ever held a scalpel or read a study. Okay, but before we go further, we have to teach the audience the language, because we had to learn it ourselves. Because if you've never been in these communities, half the words sound made up.
They are made up.
Well, all words are made up, really, right?
Well, let's try and decode them, because you can't evaluate a trend you can't translate.
Softmaxxing sounds a little naughty. The sane end? Yeah, the sane end, low-risk stuff. Skincare, grooming, fitness, sleep, good haircut.
How about this one? Hardmaxxing.
We might get censored here.
Exactly. So if you hadn't guessed it, that's the aggressive end. Surgery, drugs, hormones, extreme procedures.
Mewing. This one cracked me up. Pressing your tongue against the roof of your mouth, supposedly to reshape your jaw. We'll come back to that one because there's a grain of real science buried in a mountain of hype and garbage.
So, is that it? Am I doing that right?
Yeah.
The next one is mogging. When someone is so much better looking than you that they overshadow you. As in, that guy is mogging the whole room. It's a competition framing, which, spoiler, is part of what makes the stuff unhealthy.
Canthal tilt. Now, this is the angle of the corners of your eyes. This actually has a real definition in the medical literature as well. The communities obsess over a positive tilt. It's almost entirely your anatomy, by the way.
And the one we need everyone to hear clearly, bone smashing. Deliberately injuring your facial bones with a hard object, based on a total misreading of how bone healing works.
And we'll say this now and again later, don't do that. As surgeons, that's not a face hack. That's a facial fracture. We'll explain why.
But see, now you speak the language. You're basically fluent. Put it on your resume.
So here's the line to hold on to. Looksmaxxing isn't one thing. The whole skill is telling the evidence apart from the mythology. And that's what the rest of this show is. So before we rank the hacks, let's strip away all the noise. Lee, what does the evidence actually say that drives attractiveness?
The single most important word is multifactorial, right? That's kind of like the it depends. Attractiveness is not one slider you crank up. It's a dozen inputs, and most guys are laser focused on the one that matters least relative to how much attention it gets.
We should kind of mention, though, right, that for thousands of years, people have known that symmetry and proportion are kind of set in the human condition, right? I mean, we talk about the horizontal thirds and the vertical fifths, and there is something called the golden proportion. And with the golden proportion is essentially any part of your body. Usually, for instance, the eyes, the height of the eye is 0.66 the width. Same thing for the face overall. The width of the face is about 0.66 the height of the face. And you can go throughout the whole body. When it's really, if you look at the sculpture of David, it's like this. They've recognized this for thousands of years, and if it falls outside that ratio, it's seen as less attractive.
And we don't know why we react to these things in this way. It's obviously has an evolutionary predominance.
Yeah, it's something in our genes that makes it. Obviously, we look for things that are going to make good offspring at some level, but we don't necessarily know why. These proportions in the face and body tell us that.
Yeah,
but to
in the
get
end,
back
it's all
to your
about
point,
mating.
Right, exactly. Everything comes down to that. But the fact is that you start with, in Looksmaxxing for men, the jaw. The jaw is the thing.
Yeah, the jaw. Look, facial structure does matter. We'd be lying surgeons if we said bone doesn't matter. We rebuild it for a living. But it matters far less than the internet claims because it's competing with a long list of other signals. And here's a fascinating finding from the research. When scientists control for how healthy a face looks, a lot of the appeal of things like symmetry actually disappears. The brain is really reading health.
Let's list what's in the mix, okay?
Skin quality. Huge, clear, healthy, even-toned skin reads as youth and health. And the brain is wired to read health cues.
Body composition, right? Being lean and reasonably fit changes your face, not just your body.
Grooming, haircut, facial hair, eyebrows, nails, cheap, fast, enormous return.
Dental health, straight, clean, healthy teeth, right? A great smile outperforms almost any feature.
Hair quality, facial expression. Look, a guy who looks warm and relaxed beats a guy with a great jaw and dead eyes every time.
And the big two that aren't even physical, confidence and social presence. How you carry yourself, how you talk, whether people feel good around you.
So really, do you think, Ben, that this is, if we hearken back evolutionarily, this is finding a mate, on the guy side, finding a mate that can be a protector?
Absolutely. Women are attracted to nice, strong arms, a good build, height, cut chest, strong abs, things like that are going to allow you to go out and get food and provide and also protect. So, and same thing, men are attracted to a larger bosom, to sort of lush, full hips. And again, this is sort of associated with childbearing. And a lot of this stuff kind of makes sense. But when you look at it that way, it brings it together, again, into mating and child rearing.
Yeah. And underneath all of these is health. This is the part I want to really land. Health influences attractiveness more than almost any cosmetic tweak because nearly every attractiveness cue is secretly a health cue.
Well, so give people the concrete examples, right? Because this is where it gets actionable for you.
Weight loss often creates a bigger appearance change than an expensive procedure. It literally reveals your jaws and cheekbones. Sleep deprivation shows up on your face within days. In fact, there are controlled studies where people were rated as less attractive, less healthy, and less worth socializing with after just 2 nights of bad sleep. And smoking, heavy alcohol, age the face dramatically. Smoking alone cuts your collagen production by nearly 20%.
And fitness. People think the gym's for the body. It is. But getting fit lowers body fat in the face as well. Improves your skin, your sleep, your posture, your confidence. It's a stack of attractiveness upgrades in one habit.
And here's the punchline of the segment. Most people dramatically overestimate the niche hacks and dramatically underestimate the basics, the things that we're talking about.
Yeah, and we see this, right? A guy comes in, sits in my chair, asks about a procedure, and I'm looking at him thinking, honestly, you need 8 hours of sleep and to stop drinking on weeknights. That would do more for your face than anything I can sell you today.
Which is a wild thing for a surgeon to admit on camera, right? That, hey, what I'm doing
That's
with
true,
my
though.
hands isn't going to help you as much as something you can do yourself. It's not good for sales.
It's the most honest thing in the episode, though, right? The best version of your face is usually the healthiest version of your face. That we have a whole episode just on eating, clean eating, and actually a lot of our episodes basically wind up being a healthier person, right? The PFAS episode, the forever chemicals, right? Glyphosate, eating a healthy diet, a Mediterranean diet, all these things with the GLP-1 episode. All of these things make a healthy person, and a healthy person's attractive.
We got to be careful, Ben. We might put ourselves out of business.
I'm pretty happy with the job that we do, but I'd also be happy to see people get to a new plane of existence. I'm okay with that. Hopefully,
Totally
I'll
agree.
retire by then, though.
Yeah.
Okay, this is the part everyone's waiting for. So we're going to do a tier list. The 2 facial plastic surgeons ranking the Looksmaxxing menu. Okay. We're gonna take it from the S tier down to the F tier. Lee, are you ready to make some enemies online?
Let's ruin some supplement company's day.
Right. S tier, that's the highest impact, best evidence, available to basically everyone. And Lee, start us.
Sleep, top of the board, free, and it touches your skin, your eyes, your body composition, your mood. If you do nothing else, fix your sleep.
So you and I both have sinus and snoring institutes. You're in Florida, I'm in Texas, and we're busy. We focus about 50, 60% of our time simply on sleep. So that really rings true to us. Body composition and weight management. Biggest visible facial change for most guys carrying extra weight. Sun protection. Daily sunscreen is the single best anti-aging intervention in all of medicine. There's a gold standard trial on this, right? Daily sunscreen users showed about 24% less skin aging over 4.5 years, and also not smoking.
Yeah. Treating acne is the next one. Clearing the skin changes how an entire face reads, and it's genuinely treatable. All S tier. None of it viral, all of it works.
Okay, so the A tier, right? Strong evidence, high impact, slightly more effort or cost. Go.
A real skincare routine, and by that I mean the boring evidence-based core. Sunscreen, a retinoid, gentle cleansing, not a 12-step shelf of serums. Strength training and cardio.
Strength training and cardio. Longevity also. We're getting into health span and lifespan.
Yeah.
Also,
it's all related.
Yeah, absolutely it is. It all ties in. And a good haircut and grooming, right?
This
Take
is all
care of
you.
yourself.
This is all you, Ben. You got the best hair I know.
Right. Find a barber who actually knows your face. I'm terrible. I'll find a person and I will just stick with them. I've been with my girl 10 years. It's the highest return on time and the whole board.
Now, I have to admit here, I got a haircut yesterday by someone new. So everyone's going to have to tell me, what do you think?
Yeah, we didn't want to bring you down this early in the morning.
Oh man.
No, it looks great.
That's cold. It
looks great.
I've got very thin hair, so it's kind of hard.
Right. And also dental alignment, braces or aligners if your teeth need it. Facial hair optimization, right? The right beard generally reshapes the perceived jawline. No surgery required.
Yeah, and it's kind of interesting because we see it a lot as surgeons. Many times the people that come in with really big full beards are people that have really weak jaws, or what we call retrognathia.
Yeah. Yeah, it because it actually fills out this space, and a lot of times your jaw sits back, but you put a little beard in there and it looks strong.
Exactly. So the next two are in our world, Ben. Treating nasal obstruction and sleep apnea. People don't connect these to looks, but chronic mouth breathing and bad sleep wreck your face and your energy. Fixing breathing is health, and it's aesthetics. And we know, for example, when we see children that can't breathe through their nose, they get that what we call adenoid facies, that malar flattening there in the elongated jaw, and then they are also at risk for sleep apnea as adults.
So hair loss treatment when appropriate, and this one's important because it's evidence-based, but also it's readily available now, and it doesn't require surgery necessarily. There are really good evidence towards topicals and surgery. Finasteride and minoxidil, they have real data behind them. In one large evaluation, more than 90% of men were stable or improved. That's medicine, not a hack. Talk to a doctor. There are real considerations, but it works.
Yeah, and potentially real side effects because sometimes people are taking these medications orally as opposed to just topically.
True.
And there can be some real side effects from them.
True.
Right. So
there's also been great advances in the surgery. You know, the single unit transfer where somebody really pays attention to how the hair grows can look absolutely natural. That gets a little expensive, but like we talked about in a previous show, you know, you can go to different countries and it's not that, it doesn't have that many side effects and complications. So it's one of the things that you can actually travel for and cut costs if you need to.
Yeah, absolutely. So the next tier is tier B. So these are real gains, but they're moderate, helpful for the right person. They're not magic. And now we're spending some money.
So cosmetic dermatology, right? Botox for specific lines, lasers, skin texture and tone, judicious filler. These work. We do them, but they're polish on a foundation, right? They're not a substitute for the S and A tier. I think we'd agree with that.
Back to the old saying, you can't make chicken salad out of chicken shit.
Yep, that's. If we could just do one episode with that line, that's it.
Exactly. That would actually be a really good one. So the next is professional grooming and styling. Real, moderate, nice to have. The key with all of the B tier, it amplifies a healthy baseline. It can't rescue a guy who's sleeping 4 hours and living on energy drinks.
And now, the bottom of the board, the F tier. Overhyped, no convincing evidence, or flat out dangerous.
Jaw trainers, the silicone jaw exercisers you bite on. Here's the thing. They do work the masseter muscle. That's this muscle kind of in here. When you clench down, you can kind of feel it contracting. But bulking a chewing muscle doesn't give you a defined bone line in any way, shape, or form. And overdoing it can actually widen your lower face or strain your jaw joint. So this joint right here. You're not sculpting a jaw. You're risking what are called TMJ problems or temporomandibular joint problems.
Yeah. And most over-the-counter testosterone boosters, they're down in the bottom tier. Big topic. We'll hit it hard in the myth segment. But for the tier list, the supplements sold as test boosters overwhelmingly don't do what the label promises. When researchers actually study them, fewer than a quarter had any data to back the claim at all.
So the next group are face exercisers to reshape the bone, most influencer supplement stacks, extreme chewing routines, mastic gum all day, which again just risks bulking the masseter and stressing the joint.
And here we go. Mewing are my favorite. And let's be fair and precise here because this is where people accuse us of being closed-minded as physicians. Can tongue posture influence facial development during childhood growth? Possibly, yeah. There's a legitimate orthodontic conversation about growing kids. Can a grown adult dramatically reshape his jawline by pushing his tongue to the roof of the mouth? No, there's no science behind that.
Yeah, so there's no convincing evidence of that whatsoever. The Orthodontic Association looked and found 0 peer-reviewed studies supporting it in adults. Your adult facial bones are pretty much set. Now, we know bone is always breaking down and building back up, but you're not dealing with the growth of the bone. So when you're a child, these changes, nasal obstruction, tongue thrusting, those types of things will make a difference because the bone is actually growing over time. Good posture, sure. Hold your tongue up. Close your mouth, fine. A new jaw, it's not happening.
Speaking of a new jaw, the one that lands people in our office for the wrong reason, bone smashing, F tier, and honestly off the board because it's the dangerous one.
Yeah, the theory is a total misunderstanding of biology. People heard that bone can remodel and get denser under stress, and they concluded that hitting your face causes it to heal back stronger and more chiseled. That's not how facial trauma works.
As guys who repair facial fractures, what you actually get is bruising, possible fractures, nerve damage, asymmetry, lumps of irregular healing. You do get a bony callus over it, but it's extremely variegated and difficult to control. You can permanently deform the exact feature you were trying to improve. So there's zero evidence that it makes you more attractive and real evidence that it can wreck your face.
Yeah, so please, if you take one thing and one thing only from this episode, do not hit your face with objects.
Yeah, I was shocked when I saw that online. I mean, you can't make this stuff up. So here's the whole board in one sentence. The biggest improvements live in the S and A, the health stuff, and the viral stuff lives in F.
And the reason the F-tier hacks are seductive is the same reason every shortcut is seductive. People want the result without the boring part. But the boring part, sleep, food, training, exercise, that's where almost all of the magic actually happens.
Time for the vital message of the day, where we take a myth making the rounds and give you what the evidence actually says. Lee, we've got a stack of these for this.
Yeah, we sure do. Myth number 1, a stronger jawline will change your life.
Reality, attractiveness is multifactorial. We know that there are certain norms, but you know that there's so many things, including emotion and personality, that goes into it. One feature, even a great one, doesn't move the needle the way these communities promise. Nobody's entire life is being held hostage by their jaw. And if you think it is, BDS might be a diagnosis you have. We've literally given people better jawlines, and it did not by itself fix their life. I can promise you that.
Yeah. Myth number 2, testosterone is the answer. This one I want to spend a second on here, because it's where real harm can happen.
Go.
Most young men chasing testosterone have completely normal testosterone levels. The symptoms they're describing, low energy, soft body composition, low drive, low confidence, they overlap almost perfectly with sleep deprivation. And then we see that all the time. And people come into our office, say, oh, I think I have low T, or they've been started on testosterone, even with normal levels, and they come and they say, wow, you know what, I'm still feeling like crap.
Here's the sequence that normally happens, Lee. You start snoring. Nobody says anything about it because we think Uncle Jack snores and it's funny. Or it's annoying, so he goes in the other room. You actually slip into sleep apnea, your weight's going up, and your growth hormone that comes out between midnight and 4 a.m. drops, so your testosterone goes down to low normal. It's not great, but it's not abnormal yet. Your thyroid also usually goes off a little bit down to low normal, and you feel bad. But the root cause, so you wind up at a low T center, and they tell you, yeah, your T is not where it should be, let's jack it up. But unfortunately, that usually makes the sleep apnea worse, and the cycle continues.
Yeah, so who came first, the chicken or the egg?
Right.
And in this case, it's the sleep deprivation, the excess body fat, the chronic stress, the depression that caused the really mild decrease in testosterone level, not the other way around. So they're often treating a sleep and lifestyle problem with a hormone.
Yeah, and messing with your hormones, it's not free. In a young, healthy man, taking testosterone you don't need can shut down your own production and tank your fertility, and recovery isn't guaranteed or quick. This is a real medical decision with real downsides, not a supplement aisle confidence boost.
And I don't really think that the fertility impact is spoken about enough, because you can literally sterilize a male by giving them testosterone.
Yeah, you can wipe it out.
Depending on how far you take it and how long you do it for, it could be unrecoverable.
Yeah.
Right? So fix the sleep, the body fat, the stress first. For the vast majority of guys, that's the testosterone fix.
So myth 3, you can completely redesign your face naturally as an adult.
Here's the reality. Adult facial bone structure is largely established. You can absolutely improve what you have. Leaner, better skin, better grooming, better posture. You can't restructure the skeleton with exercise and a jaw gym.
Myth 4. Women only care about looks.
Well, that one's actually correct. No, I'm teasing. The reality, and this is straight from the research and frankly from being alive, confidence, communication, humor, status, kindness, personality, and health all carry enormous weight. The communities that insist it's all bone structure and describing a world that doesn't actually exist.
Myth 5. If I'm not attractive enough, I need surgery.
Reality. Surgery is not the answer to every insecurity, as much as we as surgeons would like to think so. And coming from two surgeons, it's definitely not the answer when the real problem is how someone sees themselves rather than how they actually look. We turn people away for this. A scalpel can't fix a perception problem.
And myth 6, the most attractive men have perfect symmetrical faces.
Reality. Imperfection, it's normal. And a little asymmetry is normal in every human face, including every face you find attractive. Symmetry is one factor among many. Character in a face is often the thing people actually love. And I don't know about you, Dr. Ben, but I have people come in all the time and they say, okay, I want my nose done and I want it to look like so-and-so, completely without imperfection. I basically want it to be a cookie cutter. And I counsel them, you're taking away all the character from your
all
nose.
the character, yeah.
And we see it in reality. For example, when we see actors, actresses, famous people that have rhinoplasty, and they've taken away the character from their nose, and sometimes they really lose their
Yeah, what's her name? Don't put baby in the corner. Jennifer Grey. She had her nose done, and it kind of ruined her career.
Exactly, that's exactly what happened to Jennifer Grey, and she's very outspoken about it.
Yeah, kind of ruined her career. It wasn't a bad nose job. Really, it just wasn't for her. It was the wrong nose for the wrong face.
She was no longer unique.
Yeah. And so here's the meta myth underneath all of them. The biggest myth in Looksmaxxing is that there's a formula that if you just do the right things in the right order, you become an objectively attractive and your life automatically follows.
Attractiveness isn't a checklist, and it's nowhere near the master variable these communities believe it is. They've promised certainty in a place where no certainty exists.
So let's get real for a few minutes because this is the part that actually matters most. When does this go from healthy self-improvement to something that needs professional attention?
Two different doors here, Ben. A medical door and a mental health door.
Yeah.
Let's do medical first because some of this is genuinely treatable and people suffer for no reason.
A doctor's visit is appropriate when, right? So severe acne is affecting your quality of life. That's not vanity, that's self-esteem, and it's a treatable medical condition, right? So when hair loss is causing real distress, again, treatable. When nasal obstruction is affecting your breathing, your sleep, your life, that's our wheelhouse, and it affects sleep, energy, appearance. When sleep apnea is dragging down your energy and your face, and when weight struggles persist despite genuine effort, there's real medical help now.
That's the good news. A lot of what these guys are agonizing over alone has an actual evidence-based treatment with a professional behind it.
Now the other door.
The mental health door. Because there's a point where the appearance focus stops being self-improvement and becomes a source of suffering. Watch for this. Appearance concerns dominating daily life. Constant mirror checking, or the opposite, avoiding mirrors entirely. Obsessive photo analysis, endless angles, lighting, measuring your own features, social avoidance, skipping life because of how you think you look, and the belief that one single feature is ruining your entire life.
And that cluster has a name, Lee. Body dysmorphic disorder, right? BDD. It's a real recognized condition. In the general population, it's maybe 1 or 2%, but among people seeking cosmetic procedures, it can be as high as 1 in 7. It's treatable with therapy, sometimes medication, not with surgery.
And that's the crucial point.
Yeah.
Someone with body dysmorphia, surgery almost never helps.
Yeah, and can be dangerous, actually, right?
Yeah, the research is really clear on this. They fixate on the next thing and the next. The kindest, most effective thing we can do as surgeons is sometimes to not operate at all and to point someone toward the help that actually works, which is cognitive behavioral therapy.
And there's no shame in that, you know? I mean, that door, I think, especially today's day and age, I think it's sort of normalized a little bit, as it should be, for people with problems of any kind to seek professional help. And that, I mean, the brain is just another part of the body. And so seeking help to help fix it and get yourself back on track is a good thing. If you're a young guy listening and any of that sounds like your last 6 months, that's not weakness. That's a signal. Talk to someone. It's the highest leverage move you could make.
Look, improving your appearance can be healthy. Building your entire identity around your appearance can become harmful. These are two very different things.
And the internet makes it dangerously easy to slide from the first into the second without ever noticing. Before we close, rapid fire. I read the question. You give the fast, honest answer. No hedging. Ready?
Go.
Okay. Jaw trainers. Sculpt my jaw? Yes or no?
No. Bulks a chewing muscle, risks your jaw joint, pass.
Okay. My favorite. Mewing for adults.
Well, I don't really think an adult should ever mew, but be that as it may, it's fine as posture.
Well, in certain circumstances.
Right. Well, yeah, it depends. So fine for posture, useless as surgery, won't reshape your bones.
Okay, next. Gua sha and face rollers.
Temporarily depuffs by moving fluid. Feels nice, changes nothing structural, harmless.
It feels good. Those little rollers are kind of good. Chewing gum all day for the jawline.
You know what that's going to do? That's going to give you a sore jaw, right?
Yeah.
And possibly joint problems. It's not going to chisel anything, so skip it.
And if you do that with the mewing, you're exactly a cow. And so the single best anti-aging product in my bathroom.
Sunscreen. It's not even close. Sunscreen will decrease the sun's effect on your skin long term and decrease the aging process significantly.
Collagen supplements.
Here's the honest read. The best independent studies show basically no benefit for your skin. The trials that look good actually tend to be funded by the companies that are selling it. Save your money. Sunscreen and not smoking do far more.
One free thing that beats every product we've named.
Hey, 8 hours of sleep every single time.
Lightning round verdict on the whole Looksmaxxing internet.
Right diagnosis. Guys can improve. Terrible prescriptions.
Here's the bottom line. Wanting to look your best is normal. There's nothing wrong with it.
The problem isn't self-improvement. The problem is when self-improvement becomes an endless pursuit of perfection with no finish line.
Most men don't need jaw trainers or peptide stacks or extreme internet protocols. They need better sleep, better health, realistic expectations.
The goal isn't becoming perfect. The goal is becoming healthier, more confident, more comfortable in your own skin. That's it.
And as two guys who spend all day, every day, thinking about faces, trust us, the face is a lot more forgiving than the internet wants you to believe. I'm Dr. Ben Cilento.
And I'm Dr. Lee Mandel.
This is Vital Discourse, and all of our content is available on vitaldiscourse.com. We'll see you next time.